Today I'm going to be talking about how oral health care is a privilege. So, oral health care should be a right, but in reality, it functions as a privilege. This is just because access to dental care depends heavily on income, insurance, and the resources that are available to the population. Essentially, if you have money, access is much easier, and if you don't, access becomes extremely limited. I think as dental professionals, we can agree that oral health is essential and it should be integrated into overall health, but our current system really doesn't express that belief. I found a LinkedIn post from Dr. Brett Kessler, which was the past ADA president, and he raised this issue publicly. And at the beginning of his LinkedIn post, he asked, is dentistry essential? And he essentially answered that with yes. But then later in the post, he asked, is healthcare a right or a privilege? And in reality, he said that healthcare is a privilege and that major reforms exist for children, but they still haven't become anything for adults. And this has left adults to be left behind. Our system undervalues preventative care. Most insurance plans only cover 2 cleanings per year, and prevention often stops there. Services like fluorides, sealants, individual education, risk-based disease management, all of this stuff is very limited. It's age restricted. It's often covered for children like fluoride, but not adults. And just a real world example of this I see every day in clinic is if I have a patient come in who's high risk for caries, I'll recommend fluoride and I'll let the patient know that that's going to be an extra $30 out of pocket, no matter if they have insurance or not. And usually the patient declines because they don't want to pay the extra $30. So cost really becomes the major barrier to the prevention. I think just dental schools in general also highlight this. We serve many underprivileged, low socioeconomic status patients. This is just due to the lower costs that we have at the dental school and also because we accept Medicaid. And then many private offices don't accept Medicaid and their prices are much higher. But when the patients come to the dental school, there's often much longer appointments. We're still learning, so they're obviously still getting the best care, but the appointments are much longer, so they might have to miss work. So just the bottom line is the system rewards treatment, not prevention. And then until access and prevention are valued, oral health care still remains a privilege.